Alrighty, hello, my name is Catalina, and today we're going to be conducting a physical assessment on Cindy here today. Before we got started, we already assessed her for her Snellen chart. She rated a level of 20 out of 20 vision, and that checks for cranial nerve number 2. And she was able to read up to line 10, but not past that. Vitals were also taken. Blood pressure read 120/40. Heart rate was 64. Respiratory rate was 15. And pulse ox was 99%. And Cindy, do you have any pain today?
No.
No? Okay. Can you verify your name and your date of birth?
Cindy, date of birth is 10/30/84.
Okay, good. And do you know where you are?
Catalinas Hospital.
Carolinas Hospital. Okay, great. And do you know the date today?
Friday, May 27th.
Okay. And do you know who today's president is?
Donald Trump.
Alrighty, patient is ANO times 4. And do you have any pain today?
No.
No pain. If patient had pain, we would conduct the Old Carton Eyes questionnaire. And how are you feeling today, Cindy? Good. Good. Do you typically feel good?
Yes.
Alrighty. And how are your bowel movements?
Good.
Good.
Mm-hmm.
When was the last time you had a bowel movement?
Today.
And how frequently have you?
Daily.
Daily. Is that normal for you?
Yes.
And what is the consistency?
Soft and brown.
Okay. Any abnormalities? Any blood in your stool?
No.
And how about your urine? Any
No.
symptoms of UTI? Any pain?
No.
When urinating? And what is the color of your urine?
Light. Clear.
Okay.
Mhm.
And how frequently do you urinate?
About 6 times a day.
Okay, great. And so we are going to go ahead and start the examination. I will be using a flashlight and touching you. Is that okay with you? Okay, great. And before we get started, do you have any allergies to any medications?
No allergies.
Are you currently taking any medications? Okay, I'll go ahead and conduct hand hygiene first. Okay, and I'm going to go ahead and assess your ear. I'm going to shine a light in her ear. There's no redness, no swelling. No redness and no swelling, and the ear canal is pink, and no cerumen is visible. I'm gonna go ahead and shine the light in her mouth. Okay, can you open? Say ah. Okay, and oral mucosa is pink and moist, and teeth are white, and tonsils were grade 2. I'm going to go ahead and check for her eye accommodation and reaction to light. So I'm going to shine the light to your eyes. Is that okay? You're going to look straight ahead, and I'm going to do this twice, okay? Great. Alrighty. And her eyes showed perla, so pupils are reactive. Equal reactive to light, and I'm gonna go ahead and also check her 6 cardinal gaze, the 6 cardinal gazes. You're gonna go ahead and follow this tip of the pen line. And this would be testing for accommodation. Good. Typically stand about 12 to 18 inches away from the patient. And next, what we're going to go ahead and do is check her lymph nodes. So I'll go ahead. This is going to require for me to touch you. Is that okay? So I'm going to start with the preauricular, postauricular, occipital, retropharyngeal lymph node, submaxillary, submental. Then one side at a time, I'm going to check her cervical chain. Then we'll check the other cervical chain. I'm going to check the supraclavicular lymph nodes, infraclavicular lymph nodes. I'm going to check for her carotid pulses, one at a time. And then I am going to also check for skin turgor. So I'll check by pinching, and there is no tenting. I'm going to go ahead and assess your cardiovascular system now. So I'm going to go ahead and place the bella of the diaphragm along her carotid artery to check to see if there are any bruits. So I'm going to have you hold your breath. And then other side. And this would be in the middle of the trachea and the SCM muscle. Next, I'm going to check her heart sounds. I'm going to start with the aortic, which is on the right second intercostal space along the sternal border. S2 louder than S1. Then I'll move over to the pulmonic, which is the left second intercostal space along the sternal border. S2 louder than S1. Erb's point, which is third intercostal space along the sternal border. S1 equals to S2. Tricuspid, which is along the fourth sternal border, along the sternal border, fourth intercostal space. S1 louder than S2. And then the apical, which is on the left midclavicular region along the fifth intercostal space. And I would check her pulse here for a minute, and the rate is 60 beats per minute. And next I'm going to go ahead and assess her lungs. And when I do so, I'm going to be placing the diaphragm on your chest, and every single time I do that, I'm going to have you take a deep breath, okay? Okay, I'm going to have you raise your arm for me. I'm going to check the right middle lobe, and that is mid-axillary line. Okay, thank you. And I'm going to check her lungs on the back portion. So I'm going to have her turn. Thank you. I'm going to have you turn over your hair. And again, every time I place the diaphragm on your back, you're going to go ahead and take a deep breath. Okay, and next I'm going to go ahead and check for respiratory expansion. So I'm going to put my two hands on your back, and you're going to take a deep breath, okay? Alrighty, one more time. Okay, so respiratory is even and unlabored. And before we move on to the next, I'm going to check your I'm going to conduct a whisper test. So I'm going to go ahead and have you turn again for me, please, your buddy. Yes. And I'm going to have you cover your right ear, and I'm going to whisper something. You're going to say whatever I whisper to you, okay?
Hello.
Okay, can you cover your left ear?
Level 1.
Okay, great. And that is going to be testing one of the cranial nerves, as well as the Romberg test. If you can go ahead and stand up for me, I'm going to have you conduct the Romberg test. So you can put your arms straight out, and I'm going to hold my hands in front of you. You're going to set your feet close together, and you are going to hold this position for 30 seconds. Okay, you can go ahead and open your eyes. And that was a negative Romberg test. There was abnormal findings. Okay, so you can go ahead and take a seat. And I am going to assess your knee reflex. So what I'm going to do is I'm gonna hit your knee with this hammer. Is that okay?
Mm-hmm.
Okay, great. Have you had any knee surgery, any knee injury before? No? Okay. Ready? Okay. And do that to the other side. Okay. And then next I'm going to check the brachial reflex. So I'm going to go ahead and do the same thing with the hammer, but in the antecubital region. Okay, good. And again, relax your arm. Okay, great. And that was a positive reflex. Good. Alrighty, so I'll go ahead and have you come lie here. We're going to conduct an abdominal assessment. Okay, and I'm gonna assess the abdomen first and make sure there are no masses, no bruising, no protrusions, and there are none, no scarring. Have you had any surgical procedures done? Okay, great. I'm gonna go ahead and come down to eye level and make sure there are no pulsations, and abdomen is evenly round. And I'll go ahead and begin by auscultating each quadrant for 15 seconds. I'm going to begin at the right lower quadrant, right upper quadrant, left upper quadrant, and then left lower quadrant. And heard about 16 to 19 gargles per minute. Next, I'm going to percuss in the same order. Any pain with that? Okay. The percussion was tympanic. Then I'm going to do light palpation. Any pain with that? Okay, great. And then I am going to assess her lower extremities. Make sure I'll move my way up from her arms down to her legs. Make sure there are no skin lesions, no abrasions, no bruising, and also check for temperature warmth. So, okay, make sure there's no edema. And then I'm going to check for cap refill. And it's less than 3 seconds. And I'll do the same thing with her lower extremities. So checking the warmth, no fever, and then checking for any edema, checking for edema on any bony prominences. Also checking for her cap refill along all her toes. Less than 3 seconds. And do you have any issues with your hips or your knees? Okay. Can you go ahead and raise your knee up to your right knee up to your chest and out and down? Good. Can you do the same thing with your left side and down? Good. Any pain with that? Okay. All right. I'm gonna have you sit up, and I'm gonna have you wave your arms up, out, and around. Any pain with that? Good range of motion. And I'm gonna have you push against my hands, and again down against my hands. Good. And then same thing with your hands. So can you press down, push up? Can you squeeze my fingers? Good. And I'm gonna go ahead and assess your cranial nerve number 7. So can you puff your cheeks? Okay. Can you stick your tongue out? Can you move it to the left, to the right? Okay, good. So your cranial nerve 7 is intact. Next, we'll check for olfactory nerve. So I'll go ahead and I'm going to have you smell 2 different items. I'm gonna have you close your eyes, and you're gonna tell me what this smells like. Good. One more.
Flowers.
Good. So her cranial nerve number 1 is intact. And the Romberg test and the whisper test conducted checked for cranial nerve number 8. And then next we're going to check her cerebellum. So I'm going to have you clap your hands on your legs really fast. Good. And I'm also going to have you rub your heel against your shin down. The other side. Down. Good. Alrighty. And anything with that? Okay. And that concludes our examination.